Patience. Going National initiative involved a large number of engagement activities while using a data-driven process to identify the 8 priority communities and select community leaders who represent new partners in these communities. This presentation describes 5 key stages of our engagement process. We sought to cultivate relationships with exceptional leaders who can elevate our initiatives to new heights, ensuring long-term success and impactful outcomes. Let's delve into the engagement metric funnel. The initial outreach marks the beginning of our engagement process, where we reach out to potential community leaders. During this stage, we reached out to a total of 114 community leaders. Our objective was to spark community interest and establish initial lines of communication, laying a strong foundation for future engagement. Through a coordinated outreach effort, we successfully connected with community leaders across all 8 communities. In stage 2, we began with strong interest. 98 community leaders responded across all 8 communities. But we weren't aiming for volume, we were focused on strategic fit. So we took an intentional and rigorous approach. Stage 2 served as a quality filter, ensuring that those who moved forward were not only interested, but also prepared, aligned, and committed. The natural attrition between initial interest and meetings stemmed from 6 recurring factors. This intentional funneling wasn't just about managing volume, it was about building a high-quality cohort equipped to address their unique health challenges with us. Stage 3 was vital for deepening our discussions about community needs and research interests, providing opportunities to identify synergies and emphasize mutual benefits. From the 57 initial interest meetings, we entered Stage 4, where 27 follow-up meetings were conducted, being sure to use Matrix 2 as a guide. This stage was designed to solidify sustainable relationships and advance potential research partnership commitments. Leaders were encouraged to share concrete examples of their work, offering deeper insight into their roles and contributions. Stage 5 involved a scoring process to determine finalists based on criteria outlined in Matrix 2. This evaluation ensured that the potential leader selection process would advance the patient's program's strategic plan goals. Ultimately, 4 leaders progressed to the final stage, where deeper conversations occurred to identify elements of specific memorandums of commitment. This reflects a deliberate, data-driven shift in engagement, highlighting our success in converting interest into commitment. Now that we've identified our first cohort of new partners, we are working with these community leaders to develop patient-centered research proposals. With the help of these new partners, our future research will have a greater national impact. We'd like to thank our sponsors, AstraZeneca, Bayer, and Novo Nordisk, for supporting the Patients Going National initiative.